Yeah.
Very, very thorough. And when I go to her, we just, we sit and have a conversation about me and what I want, what I feel. And sometimes we just connect in what I don't want.
Yeah. I've had that conversation with you a few times as well.
Because I know what I want.
Yeah, and
I
I
know
think
what I don't want.
I think most patients are really like that. I think most patients, they do, and if you listen, they'll tell you. And I think that good doctors work with their patients, and try to really make something work that is good for that particular person.
I think when I found Dr. Miller, I think I found a good thing. And then when I found you, I found another good thing. Because y'all listens to me. I went to the doctor one time and my shoulder was hurting like it was the other day. I mean, it was D.P.M though. I mean, it was so painful I couldn't move my arm.
Oh.
And he gave me a slip and told me to go over on somewhere. I forgot where he told me, but this has been quite a few years ago. And they'll give me a pregnancy test. I had 7 babies and I had 9 on my shoulder. I wasn't pregnant on my shoulder. But the thing of it is, when you talk to a doctor and they don't listen to you, then, y'all not communicating. And I like to communicate with my doctor.
It's very, very important. And I think sometimes that gets lost in this modern medicine concept, which is really, really a shame, which is
Right.
one of the things that you and I both know is really nice about Lifelong, because people do take more time there with you want to get to know their patients, and yeah, I think that's a real plus.
They try to shift me off to another doctor. No, I'll wait till Friday. I got to go to Dr. Miller Friday.
They did tell me that.
Because every time I change doctor, every time I go and my doctor's not there, they give me another. They try to change stuff. They be trying,
That's because they're just looking at numbers.
I'm going to write you this, and I said, my doctor will give me all the prescriptions. I take enough medicine. I don't need no more. Or I don't need what I got changed. Go ahead. Give me some more.
Yeah, and I think I think it's very important anytime any doctor's working with any patient. I think that regardless of what your specialty is or what you do, that you have to listen to what the person wants, and you have to make sure that you work as partners, so that the goal is that that person wants to make their health better, and that they want to do the things that are necessary, and they understand why it's important. Because I think that there are too many doctors that want to just tell you this is what you have to do, and they don't really go through figuring out what the person's needs and wants are, and trying to make things work for them. I think that especially with diabetic patients, that a lot of people are in denial about really having problems with their feet, and they really don't really want to listen, and they don't really want to be part of a team. They just want to kind of pretend like they checked that thing off their list. They went to that doctor, they took care of it, it's done, and not necessarily make any changes or anything like that. So if you don't work as a team, if you don't make sure that that person understands what the implications are of their sugar being high, or of whatever, other components, their blood vessels being blocked off, or like we talked about with the bleeding behind the eyes. And if you don't understand why that happens and what will happen if you don't change things a little bit, then there's no reason you're going to change. Because people are afraid of change, always. And there's got to be a darn good reason for them to want to change.
That's true. That's true.
So I was talking to somebody